Welcome to the Depth Dive. Today, we're really digging into something that affects so many people. These smartphone apps for self-care, particularly around depression and anxiety. It really makes you wonder, doesn't it? How are you navigating your mental well-being in today's, super digital world?
That's exactly the question. Yeah. In this deep dive, it's drawing on a really interesting sociological study. It didn't just ask, do these apps work?
Yeah.
It went deeper, looked at the real motivations, the day-to-day experiences, and the bigger social effects for people using them.
Okay.
They actually talked to 14 individuals in England, all diagnosed with depression or anxiety, who are using these kinds of apps. So it gives a really unique window.
Right, a unique window. Okay, let's unpack that. So the study found many people first turned to these apps. Well, because they were in really tough spots. One person called it a truly desperate situation, often feeling let down by the health system, citing things like long waiting lists, services just being totally overwhelmed. Sounds like they needed something right then.
Exactly. That urgency, it often led to this quite spontaneous way of using the apps. What's really striking is that people often started with a lot of hope, almost like a tech optimism, thinking maybe this digital thing can fix it,
Ah, yeah.
which then led to this very casual sort of try it and see approach. Downloading apps, deleting them, not much deep thought maybe. And here's where it gets really interesting. Often, these apps were seen almost as a replacement for people.
A replacement. Wow.
Yeah, some users actually prefer them. One person said, you can't have a negative impact on an app, or they're worried about being a burden to my friends. Understandable, but, it could unfortunately end up increasing isolation.
I can see that. The appeal of not feeling like a burden is strong. But if that convenience and privacy were key drivers, did the study find any knock-on effects from choosing apps over people?
Absolutely. The phone's convenience, right? It's familiar, it's private.
Yeah.
That definitely made the apps appealing. Users often saw them more as tools for maybe self-enhancement, not necessarily like formal treatment. They valued the low-effort side of it.
Low effort. Okay.
And what's fascinating is that the main benefits seem to be immediate relief in moments of acute distress, like panic attacks. The apps offer distraction, maybe soothing sounds or visuals. You can almost picture someone frantically scrolling,
Right.
looking for anything.
Yeah, just something to grab onto in that moment.
Yeah.
That makes sense. But you mentioned earlier something about apps being imaginarily active. What's that about?
Yes. That was really interesting. It means people found real comfort just having the app installed, like a security blanket or a safety net. Even if they weren't actively using it much, just knowing it was there was somehow reassuring.
Like a potential lifeline.
Kind of, yeah. But the study also called this a stopgap benefit, because when things got really severe, the apps often weren't effective. People felt they sort of outgrew them, realizing, it can't help you further than that with the deeper stuff. It shows their limits.
All right, limits are important. Okay, so moving on to how this all shapes our actual understanding of mental health. The study pointed out that apps seem to foster this strong sense of personal responsibility. Like users felt a sense of duty to use the apps. Some even recommended them to others, even if they weren't personally finding them that helpful. And then feeling, disappointed in myself if they didn't engage enough. That sounds like a lot of pressure.
It is. And that's a really crucial point. Because if you connect the dots, this focus on personal responsibility through apps can, maybe unintentionally, feed into what the researchers called a reductionist biomedical view of mental illness.
Reductionist biomedical meaning.
Meaning, sort of, narrowing it down. Seeing mental health challenges primarily as just symptoms, like a purely medical issue inside the individual. Think about mood tracking features. They give you this seemingly external and objective graph of how you feel.
Right, data.
Yeah, data, which can be useful. But it might also overshadow looking deeper, at the social factors, the environmental stuff, the life circumstances that are contributing to the distress in the first place.
So it kind of individualizes the problem maybe too much.
Potentially, yes. It puts the focus squarely on the individual managing their symptoms via the app rather than looking at the bigger context.
Okay, so pulling this all together, what's the takeaway here? This deep dive really shows a complex picture, doesn't it? These apps, they offer undeniable convenience, maybe some immediate relief, but they also might subtly push people towards isolation or this narrower, more individual view of mental well-being. It's contradictory.
It really is. And that brings us to a pretty important question for you, our listener. How do we find the right balance? How do we use the empowering, flexible side of these digital tools while still ensuring we have access to and value that comprehensive, holistic mental health support? the kind that addresses the whole messy, complex picture of human distress, is definitely something worth mulling over, isn't it?
Yeah.